Today on Alzheimer's SOS, we want to start with the basics. A common question families ask is, what's the difference between dementia and Alzheimer's? Well, here it is. Dementia is the umbrella term for any disease that causes memory loss, personality changes, impaired judgment, and ultimately, it robs people of the ability to make their own decisions and to remain independent.
You know, I've heard that there's about 50 different types of dementia.
Now, it's true that out of all those dementias, Alzheimer's dementia is the most common type. But somehow over the years, people started separating Alzheimer's disease from all the different types of dementia. I've even heard people say, oh, thank God it's not Alzheimer's, it's just dementia. We got to remember that Alzheimer's is a type of dementia and there's many kinds.
You know, we take care of a lot of people with all sorts of different types of dementia, and the families and the patients all need our help.
Let's go over a few of the different types. 60% of all dementia diagnoses are Alzheimer's dementia, and that can even start in middle age. The damage comes from abnormal proteins in the brain, which then build up and disrupt the normal connections between the brain cells, also known as neurons.
You know, and there's a lot of people that have vascular dementia.
And that's also called multi-infarct dementia.
That's a little mini stroke,
That's
isn't it?
what it is. That's about 30% of all dementia diagnoses. So here we are up to 90%. Now these strokes cause little gaps in the memories, little losses of abilities, and it's often seen in people with other cardiovascular diseases like high blood pressure, high cholesterol, peripheral artery disease, and especially diabetes.
And then there's the Lewy body dementia that often looks like a combination of Alzheimer's and Parkinson's disease. But they'll have the stiff Parkinson's walk where there's the small steps and no swinging of the arms, the emotionless face, and it even has the tremors.
And patients with Lewy body dementia also have visual hallucinations as their first symptom very often, or they have REM sleep behavior disorder where they act out their dreams. If they dream they're running a race, they're running in their sleep. If they dream they're in the ring with Rocky, they are kicking and fighting. They also have other physical symptoms like maybe a drop in blood pressure when they stand up and they end up fainting.
One of the toughest diseases is the frontal temporal dementia that affects judgment, personality, and memory. These individuals usually pass the memory test without any problem whatsoever. But there are the dangerous and risky, embarrassing behavior that is very inappropriate to family members. These individuals may be very inappropriate at the IHOP, to the server, to, individuals there.
Yeah, they're taking risks, they're speeding, they're gambling away the life savings, and it's really a painful and difficult disease. There are some pretty rare diseases, types of dementia that we've seen, like primary progressive aphasia, where brain damage results in the inability to speak or to understand words.
And there's normal pressure hydrocephalus. This is one that's very near and dear to my heart. I was diagnosed with normal pressure hydrocephalus when I was 26 years old. And they place a shunt inside your brain to drain the cerebral fluid where the ventricles do not work. And, praise God, it worked. And
because the damage is done when that cerebral spinal fluid builds up, it pushes on areas of the brain that affect memory and walking and bladder control. Another really difficult disease. We also have people who have an underlying dementia that's made worse by different medical conditions, like untreated thyroid disease, B12 deficiency, sleep apnea. Sometimes the patient's lifestyle can make things worse. Alcohol can cause a dementia. It can cause the dementia of other types to progress more rapidly. Our little rule of thumb is 1 alcoholic beverage in someone over age 65 is like 3 in a younger person. Any alcohol someone takes in, it's going to triple the effect. Now, each one of the diseases that we mentioned have information available on websites that are devoted to that particular diagnosis. We just want to let people know that there are lots of different types of dementia, and it's crucial to get that accurate diagnosis and to start treatment early.
We are here to help you by sharing what we've learned and our experiences,
as well as relying on the experience of experts and, of course, our caregivers, what we've learned from them. Thanks for watching Alzheimer's SOS.